Excuse me, ma'am. Afternoon.
Yes.
Ang kuan ma'am ba, ang 3A ma'am ba kay sa 10:30 to 12?
Mm-mm. Yes, yes. Okay, for 3A, let's just give your other classmates 5 more minutes before we start. Ha? Kindly tell them to join. Thank you. Okay, good afternoon, everyone. So, today we are going to continue our discussion, and we are now on our lesson under pharmacokinetic of toxins. So, based on 3B earlier, maybe we will have the list of antidotes and the antidotal references tomorrow after our group quiz. So, let's start. I guess everyone is here. Um, Let me just ask any of you here. You can answer any of you. Again, what is the difference from your pharmacokinetic and pharmacodynamic? So this is very luma na kayo nga question, but I just want to reiterate it right now since we will be talking about pharmacokinetic of toxins. So what could be possibly the difference again of pharmacokinetic and pharmacodynamics? By the way, can you hear me? Hello? Okay. So, what is the difference?
Yes, ma'am.
Okay, thank you, Ray. Now, what is the difference again between pharmacokinetic and pharmacodynamic? Yes, Axel.
Based from our pharmacology nga discussions, ma'am, pharmacokinetics is what the body does to the drug, and it's a branch of pharmacology, ma'am, wherein we'll be tackling about the absorption, distribution, metabolism, and elimination. Basically, talking about the movement or the kinetics, as the word implies, pharmacokinetics. While on the other hand, ang pharmacodynamics naman, ma'am, is what the drug does to the body, so unsa iyang effect. So in here, it's a branch of pharmacology gyapon which gina-study niya ang effect, mapa-biochemical man or physiological nga effect, and apil ang mechanism of action sa organ, or even deeper like sa subcellular or even sa macrocellular nga mga levels, ma'am.
Okay, thank you for that, Axel. Well, yes, that is true. Now, ideally, that is a fact under your drugs. However, your pharmacokinetics of toxins, well, ideally, not all toxins are xenobiotically um, categorized as chemical substances. We also have forms of drugs that can or may cause toxins in our body, especially if it is more than the recommended dose that was prescribed to a specific patient. So right now we will be tackling about pharmacokinetic of toxins, and again, this differs under your absorption, distribution, metabolism, and elimination. Now, earlier, I also mentioned that aside from the other categories under xenobiotics, well, of course, we consider drug as xenobiotic. Now, the overdosing of a drug can alter the usual pharmacokinetic process of that specific or the specific therapeutic effect that that specific drug might cause the patient or might help the patient. So once you say overdosing, it is the first level of toxicity in our body. Now, this must be considered when applying kinetics to poison patients. So we know if we have the right reference of a specific drug that was administered to a patient, if dili wala siya nagsulod sa iya ang recommended dose, we will know ideally if we will just refer to the paper that or the prescription that was given. However, we can imply the possible effects if makita nato ang patient mismo, if how does the overdosing of the drug might manifest outwardly to a patient. However, ang isa sa pinakalisod lang buhaton is if the toxic or the chemical substances are excreting or nag-manifest or nag-release sa iyang toxic effect, mas penetrating siya sa sulod. Kaya dili ninyo siya diretso makita outwardly. But let's for example, the solution of tablets or gastric emptying time. We all know that the dissolution of the tablets, or what must we all know, the gastric emptying time, they slow the absorption of a specific drug effect, and the peak toxic effects can also be delayed. Now let me ask you something. If a person nagkaon siya daan before administering a specific drug that was instructed that it must be taken with or without meal, what will happen to the patient? If ang patient nagkaon siya og food before taking a specific drug, what usually will happen? And it was instructed that the patient the patient's drug can be taken with or without meal. What will happen to the patient? Or how is the effect of the drug towards the patient? Okay, go ahead, Ray.
In that case, ma'am, in that scenario, if the patient took the medicine before, before to, di ba, ma'am? Before meal, and then he was instructed to either take it with or without food, the effectiveness of the medication may be influenced depending on the absorption and the distribution of the medicine or the drug. So, if kanang nag-take siya sa tambal before eating with an empty stomach, um, it may alter the pharmacokinetic. So, mas kanang mas fast siguro ang absorption sa iya, kaya ang iyang gastric emptying man pod kay it will be slowed. And then um, if taking the it with food po dayon, kay if in another instance, I mean if katong yang case nga wala siya nag-take with food, the effectiveness in the other hand will kanang sometimes siguro kay wala man siya gi-imply good mga mag-take siya with or without. So possibly yeah, absorption siyang tambal kay pas since wala kay kanang empty man iyang
Okay, thank you for that, Ray. But ideally, if the instruction of the specific drug can be taken with or without meal, well, ideally, the specific importance that we should always think is that if it is taken before meal, well, mas pas pa siya. However, if it is taken after meal, as long as the drug is being identified that it can be taken with or without meal, well, still that is okay. However, let me ask you one more thing. If a specific drug is being taken higher than the recommended dose of the drug that was given to a patient, and it was instructed to be taken before meal, what could possibly be happening to the patient? Again, the scenario is quite different now. The patient intakes more than or higher than the recommended dose that was prescribed to him or her before meal. And yes, he was able to take it before meal. However, in a higher dosage, higher dose prior to the recommended dose that was prescribed to him, what could happen to the patient? Yes, go ahead, Ray.
In this case, ma'am, if kanang higher than the usual dose ang intake sa gosh, sorry kay sa docs. If higher than the usual dose ang iyang intake tapos nag-take pagit siya before meals with an empty stomach, there would be a greater possibility nga ang toxic effect sa tambal sa iyang body would be higher kay siguro if ever na there is a food, dili empty yung stomach, madelay pa ang kanang peak sa toxic effect sa iyang tiyan or sa iyang sa tambal mismo. Pero at least case mo good, higher than the usual dose na siya and then before meal pwede siya nag-take. So prone to toxicity or there is a greater chance good nga murag kanang ma-intoxicate siya sa tambal.
Okay, thank you for that, Ray. Well, that could be one of the possible result if a specific drug is being taken higher than the recommended dose. However, we still also need to consider how high or how unsa ba siya ka more than sa recommended dose. Because again, depending on the dose of a drug, it also depends on the duration nga naa siya sa atong body or how can it be metabolized. So as we continue, with a dramatic increase the concentration of drug in the blood, protein binding capacity may be exceeded. So again and again, if you are going to intake a specific drug higher than the recommended dose, dili siya mobita ng every drug is being calculated accordingly to the patient's age, to the patient's weight, okay, depending on that. However, if mo exceed gali siya, the proteins that are kanang responsible, no, the on the binding of that specific particular substances that our body needs, more than gali ang mga xenobiotic nga ila ang ma-receive on that specific drug, well, dili siya of course mabind tanan. So what could possibly happen to those nga dili mabind or could not specifically reach directly the site of action? Maglutaw-lutaw siya sa body, ma'am. Siguro, ma'am, mangita siya someone inside the body. Well, of course, resulting of it, it can increase fraction of free drug inside your body. And again, if it could not bind, mangita siya all around your body kung asa siya mo fit, well, gapangita siya, there can be a fact or there can be an outcome of greater toxic effect of that specific drug, some substances that was or that is been taken that is more than the recommended dose. Now, the toxicant may have to pass many barriers to get to its site of action. So, ang isa ka factor, kung dili siya if dili siya easily makabind, napa siya agian nga daghan nga barriers. Now, what could be the possible barriers that you can remember before a drug can get to its site of action? Let's not talk about toxicants. Let's talk about drug. What could be the possible barriers that they need to pass through before getting to the site of action? Okay, so one of which is your BBB or your blood-brain barrier. Now, same goes with your toxicant because your toxicant is also in a form of xenobiotic. It is also a foreign substances that is being or ni-enter sa portal sa ato ang body. Now, the intensity of a toxic effect depends primarily on the concentration and persistence of the toxicant at its site of action. So, if you will try to enlarge your imagination or widen your imagination, ang kanang ang mga substances, mag-unahay baya na sila og bind. So, as we try to reconsider the concentration and the persistence of that specific toxicant that was ga-float lang siya, finding something to bind off even though they have passed through a lot already, it could still manifest or release its effect or its toxic effect. Now, the ultimate toxicant is the chemical species that reacts with the endogenous target molecule. And this is considered as your receptor, your enzyme, or known as also your ligand substrate, and also your biomolecule, such as your DNA, protein, and lipid, which are very critical as well. Now, this critically alters the biological microenvironment, initiating structural or functional alterations that results in toxicity. So there are these toxic substances. They are quite harsh because dili naman sila kabalo asa sila mo padulong. Because then again, since it is more than the recommended dose that was given to them, they need to fight for their right also. Though they are on the same substances, but trying to fight for their individual right. Kung asa sila pwede maka-bind. So let's try to see the possible or the pre-systemic elimination that they can handle. Now, the accumulation of the ultimate toxicant at its target is facilitated by, again, absorption, distribution to the site of action, reabsorption, and toxication, or also known as your metabolic activation. Now, as you can see, under metabolism, if you can remember, that is the area which a drug can be activated or inactivated. However, if we will try to intake a specific, let's say for example, it's no longer drug, it is a chemical substances. Now, once it is already been taken or sulod na siya sa portal sa tong lawas, we cannot just say nga, oops, wait lang ka ng wrong ko og na intake. No. Once it is being taken, labi na og nasulod na siya sa inyong esophagus, not also referring to the IVs ha, kaya once it is being injected to you, of course, dili na siya mabalik. Kung imong i-try og kanang try to kanang murag inyong i-suck out ang specific nga substances that or kanang liquid that was already entering the body, if inyo na i-try og suck out balik, dili naman ang katong specific nga drug ang mogawas. Dugo naman siya, di ba? It is already kanang na-mix out na siya. So that is only the most dangerous thing about the parenterals, especially the IV. However, if you are going to have it per oral, kung matulo na ninyo siya, kaya ba ninyo siya masuka diha dayon? It could be if you are going to kanang tingalo ninyo inyong baba, but then again, dili pasabot nga masuka ninyo siya, it is 100% already taken away from the body. Di ka na malikiyan that there are already particles, especially chemical substances such as your chemicals. As for example, your lead, your barium, dili pasabot nga na inyo na siya nasuka, na gawas na gyud tanan. Na siya mga substances nga nabilin gyapon sa inyong lawas. And take note, we have specific transport that are susceptible to these elements. So mo nang isa sa to i-reconsider. However, under pre-systemic elimination, distribution away from the site of action, excretion and detoxification oppose this process and work against the accumulation of the ultimate toxicant at the target molecule. So later on, you will know what are the factors that enhances the distribution of the toxicant in your body and what are the factors that can oppose nga mapasulod siya even more sa inyo ang body or it can be well distributed under your body. Now, before we got to see those factors, let us also remember that our body has its normal defenses. Now, again, as what Axel mentioned earlier, we have the blood-brain barrier, or these are also known as your membrane barriers. Now we have the under your membrane barriers, we have your passive, your facilitated, your active, endo, exo, and so on and so forth. We also have your biotransformation enzymes. Usually, biotransformation is under your metabolism. We undergo this phase 1 and phase 2. And we have enzymes that helps out under the biotransformation. And aside from that, we also have antioxidants. And lastly, we have elimination mechanisms. Of course, we cannot just, like, come to think of it, grabe lang yun kay ka-amazing si Lord that if we have the portal na makapa-enter sa tong body o mga foreign substances, napod gid siya exit. Can you come to think of it, if walay exit area or it cannot be excreted anywhere in your body, what will happen to you? Siguro, tananta are being poisoned already. Because as a person, dili gyud ta always responsible sa atong body. Even though, let's say, we are responsible, we are really taking care of our body, we are protecting our body, even the internal organs that we have. However, if there is a person that has a motive of not doing good to us, of course, they can try, no, to think or manipulate us through giving us a chemical substance that is not healthy or cannot benefit our body and may cause toxicity. So these are the functions that usually happens under pharmacokinetics. First, we have the absorption. Again, this is the transfer of a chemical from the site of exposure, usually could be external or internal body surface. So we have our three three portals. What are those portals? If you can remember, what are those portals that can allow toxicants to enter our body? Hala, what are those? Inhalation, what else? Yes. What are the other two? Ingestion and alimentary. So it could be under your skin, mucosa, or your respiratory tracts. Okay. Before siya mo adto sa inyong systemic circulation, if that is not under your parenteral, specifically intravenous. So these are the portals that can allow the toxicant to enter your body. Now, the rate of absorption is related to the following: the concentration of the chemical at the absorbing surface, which depends on the rate of exposure and the dissolution of the chemical. Then again, we should always reconsider the rate of exposure of the specific chemical substances. Let's say, for example, if a person is being exposed to lead or to barium in a small amount, of course, the lesser the chemical substance is that we are being exposed to, gamay ra pod na ang possible nga masulod. However, if it is quite on a large amount, of course, it could also be on a large basis nga maka-enter siya sa ato ang body. Now, we should also consider the area of the exposed site. Lisod sad kung ang area of exposure nimo is sa skin, dito ka ni adto sa imo ang ilong. No, of course, we should always go to the possible, not unless if it has an aerosol type of kanang substance. So we can also reconsider that. But the main thing is that we should first think of asa siya na exposed basically. If it is on the skin, then check on the skin immediately. Secondary, go on the other possible portals. Now, aside from that, we can also reconsider the characteristic of your epithelial layer through which absorption takes place. So, of course, it is part of your skin. So, as we all know, the largest organ of our body is our skin. Same goes with your fourth consideration, the intensity of your subepithelial microcirculation. And aside from that, we should also reconsider the physicochemical properties of the toxicant. So as you mentioned earlier, sa gingon ni Axel ganina, based on the pharmacokinetics, it could be under your biological or physiological. However, under your toxic substances, we should reconsider the physicochemical properties of the toxicant. So, if a specific of course, chemical substances differs from drugs, okay? So they have different physicochemical properties. Now, what could be the possible physicochemical properties that we need to consider under the physicochemical properties of the toxicant? What do you think? It could be the the volatility of the specific chemical substances. It could be the if it is under aerosol substances. It could be we could reconsider the physical chemical vapor pressure, or if it is under particles, we can think of the molecular weight or the size of it, or if it is particles that can be diluted, how about the solubility? We can also reconsider it. There are a lot of physical chemical properties that we can consider, especially on this, because toxicants differs in what form they are. Okay, so aside from that, we also reconsider the lipid solubility. Now let me ask you, if a xenobiotic enters a human being's body, in what form sila usually? Ang xenobiotic.
Lipid soluble.
It is lipid soluble, or mostly it is also known as your hydrophobic substances. Okay? So if a lipid soluble or a substance under a lipid soluble state enters your body, can it possibly be excreted still on the state of hydrophobic substance or lipid soluble? Can it be excreted in a form of lipid soluble still? If nisulod ang xenobiotics sa imong body in a form of lipid soluble, can it be excreted as lipid soluble as well? Excreted in the body na ha. What do you think? Any of you? What do you think? No. For what reason? Because the main the main function of the excretion is that they try to distinguish if that substance is already in a form of hydrophilic or water soluble, because mainly those things that needs to be excreted, they need to be converted to water soluble or hydrophilic substance. Again, even if they gone through or they were entering the body in a lipid soluble state, they still need to be converted to hydrophilic substances or water soluble in order for it to be excreted in the body. Okay? So, muna itong timanan. Usually, kay ang uban tao manggod kay moingon nga, if dili lugar ma-turn siya into hydrophilic, mag-retain na lugar siya sa body? Yes, it could happen. Retention could happen if it cannot be converted into hydrophilic. So, aside from those, these are, well, this is just a review of your route of administration. Well, these are the route of administration under your absorption. So we have there the intravenous, inhalation, ingestion, intraperitoneal, dermal, or topical. So your intraperitoneal is just like your ingestion. However, it does not require absorption through your GI tract. Okay? Now, of course, under your absorption, it could also undergo pre-systemic elimination. Not unusual for chemicals absorbed from the GI tract because they must first pass through the GI mucosal cells, liver, and lung before being distributed to the rest of the body by the systemic circulation. Now, one of your example here is your ethanol. Now, ethanol is being oxidized by, of course, since it is a form of alcohol, well, it is oxidized by alcohol dehydrogenase in the gastric mucosa. Now, such process may prevent a considerable quantity of chemicals from reaching the systemic blood, but may contribute to the injury of the digestive mucosa, liver, and lungs by chemicals under it. So, again and again, there are specific chemical substances that are really not beneficial to the body. If so, there are chemicals under it that could destruct. Okay, destruct a specific process, destruct a specific area or organ. Well, we have considerations like that. So aside from the absorption, we have distribution. Now, just a review, distribution is a process in which a chemical agent translocates throughout the body. So just like your drugs, of course, in order for the toxicant to release its toxic effect, it still needs to be distributed. Okay? But even though dili siya widely distributed, it can still cause its toxic effect or release its toxic effect. Now, blood carries the agent to and from its site of action, storage depots, organs of transformation, and organs of elimination. Well, just like your drugs, these are the following possible kanang no, not your drugs, but if your drugs has this site of action, of course, the toxicant or chemical substances has their own kung asa pod sila mo take effect. Even though there are circumstances nga if they are not being fully distributed, they can already release its toxic effect hinay-hinay. Okay, so we have there your DDT in your fatty tissues, your lead and your fluoride in your bone, and distribution may really change over time. Now, the rate of distribution could be under rapid status, can be dependent upon the blood flow, of course, characteristics of your toxicant, if it is affinity for the tissue, and the partition coefficient. So, dili lang sila sa tissue actually ha. Again, as what I mentioned earlier, they are also susceptible through your transports. So, lipid-soluble compounds moves readily into cells by diffusion. Highly ionized and hydrophilic xenobiotics are largely restricted to extracellular space unless specialized membrane carrier systems are available to transport them. Motong yun kaganina, there are specific transport that only susceptible to specific elements as well, or chemical substances. Now, I mentioned this earlier that there are specific toxicants or distribution of toxicants to specific target sites that could be enhanced by the following factors. First, we have here the porosity of the capillary endothelium or your endothelial cells in the hepatic sinusoids and in the renal peritubular capillaries. If you can imagine how could or unsa kadak ang pore size in yung capillary endothelium. So usually the capillary endothelium has a pore size of 6.5. 6.5 yung kadaka. Well, this permit passage of even protein-bound xenobiotics. This favors the accumulation of chemicals in the liver and kidneys. So as we all know, once it is being distributed sa inyong kidneys, of course, it is already doing its function. So again, what is the main function of your liver?
Metabolism.
It is for metabolism. So So once it is accumulated already, or nagather na ang mga chemicals sa liver o kidney, well, you know what will happen next. Okay? So aside from that, specialized membrane transport. Isa po din siya sa makapa-enhance or makapaspas sa distribution sa inyo ang toxicants. For what reason? Let me... Now, specialized ion channels and membrane transporters can contribute to the delivery of toxicants to intracellular targets. Let's, for example, your aquaglyceropine. Usually, these channels may mediate influx of your arsenate, which is a present at physiologic pH that is uncharged. So, if the calcium channels permit the entry of cations such as your lead or your barium ions into excitable cells, and your electrolytes such as your sodium, potassium, ATPase promotes intracellular accumulation of the tallus ion. So again, there are specific charges of or pH that can be reconsidered, and that is susceptible to your specific membrane transport. So if they're already susceptible to that, kailangan nang mapapaspas ang distribution sa inyo ang specific toxicant. Let's, for example, if it is made of your lead or your barium or ions, well, it could really help out. So we should also reconsider those. Aside from that, we have accumulation in cell organelles. Wait lang nga. Okay. If you can remember the amphipathic xenobiotics with a protonable amine group, so what is your amine group? It's one of your functional group. And lipophilic character accumulate in lysosomes as well as mitochondria, which are also a part of your organelles. They can cause adverse effects if they have gone through that. Let's, for example, lysosomal accumulation or gathering occurs by pH trapping, that is diffusion of the amine or the amine. So, naay mga factors nga ang inyong mga cell organelles or ang ato mga cell organelles can enhance or can, it's not in a form of enzyme, but mapapaspas nila ang accumulation or pag-gather sa specific toxicant para easily na lang siya distributed sa inyong body. So one of which, isa po siya sa ginatanaw nga factor nga nung paspas gaka-distribute ang mga chemical substances sa atong body. And lastly is your reversible intracellular binding. Let's, for example, binding to the pigment of your melanin. Now, an intracellular anionic aromatic polymer, its mechanism by which chemicals, since it is an organic, it could be organic or inorganic cations and polycyclic aromatic hydrocarbons can accumulate in melanin containing cells in your retina. So there are specific functions or structures that could be reversible under the binding of your intracellulars. So these are the 4 factors that na-highlight siya in terms of enhancing distribution of toxicants. But of course, if there are factors that it enhances it, we also have factors opposing the distribution to the site of action or target. So the processes includes binding to plasma proteins, specialized barriers, distribution to storage sites such as your adipose tissue or bones, association with intracellular binding protein, and export from cells, which is more understandable in their cases and in their functions and in their processing. So let's go to the target organs. Adverse effect is dependent upon the concentration of active compound at the target site for enough time. So nasa duration. Not all organs are affected equally, even though it is being distributed. Thus, for example, greater susceptibility of the target organ or higher concentration of the active compound. Now let's move to the specific targets or organs, okay, that they can manifest or they can release their specific actions or effects. That kung sa liver, in the form of high blood flow, it could be done by oxidative reaction. Sa kidney, it could do the same under high blood flow, but it differs on how it is being perceived. It is through concentrates of the chemicals. So lahi sila sa liver. Kung ang liver under oxidative reaction, ang kidney under the concentration of the chemicals. Same goes with your lungs. However, mas prone sila sa site of exposure. Kung unsa ka huge or unsa ka daka or unsa ka wide ang exposure sa lungs. Now, aside from that, you have your neurons. Well, of course, we all know neurons is located sa asaman. Sa digestive system. Asa sa inyo ang brain or asa ang system?
Sa brain po.
Yes, under what system ang brain?
CNS.
Okay. So, since we all know that our brains needed oxygen, mabitaw ng usahay, no? If kanang unsa ni tawag na ay mga persons nga feeling nila they were exposed to certain chemical and then they are lacking water intake, mingon na dayon nga pag inom lagi daghan tubig, kulangan na na og oxygen imong brain. Tunay mga nga mga storya. But because it is really dependent on oxygen ang ato ang neurons. So that is why it also affects, no? However, it causes irreversible damage on our neurons. Also for your myocardium, or ideally it is located, if ang neurons located sa inyo ang brain, how about your myocardium? Okay. So both of these, okay. Thank you for that. So both of these are oxygen dependent. Now, under your bone marrow, your intestinal mucosa, these are rapid divided. So since one of the large pod nga category under our body is our bone marrows and intestinal mucosa, depende siya. They vary on the division that they will get. Okay? So lastly, we also have the adverse effects that can occur at the level of the molecule, cell, organ, or organism. Now, one of which is it is done molecularly, which chemical can interact with our biomolecules. This pertains to your proteins, lipids, and DNA. And on the other hand, if it is molecularly done, we also have cellularly done. Chemical can interfere with receptor ligand binding or your enzyme substrate binding. And aside from that, it interferes with membrane function, cellular energy production, and again, it could possibly bind to biomolecules. Okay? And it can also perturb homeostasis. So what does it means of the perturb homeostasis? So it is not settled, no? What will happen if unsettled or really stable ang inyong homeostasis? What could possibly happen? Guys, from the word itself, homeostasis. No, it maintains the internal stability of your body. while ga-adjust sa external conditions. So kung unsettled ang yung homeostasis, well, of course, something not good is really going to happen. Now, aside from the absorption and distribution, we also have your excretion. So maybe you were thinking, Mom, ang next sa distribution kay metabolism pa man. But let's try to think of this before coming through the metabolism. Now, excretion is a removal of chemicals from the blood and the return to the external environment under a physical mechanism, whereas biotransformation is a chemical mechanism for eliminating the toxicant. So, your excretion for drugs, same goes with your toxicant. However, if your drugs are being excreted under your body in a form of a water soluble or hydrophilic state in a dose or in a size that is being pertained to the intake or the recommended dose that is being taken by a patient, well, for your toxicant, syempre more than man siya. Or let's say it is something that is not good for your body nga na-intake sa specific person, it is not totally eliminated even though some of the particles are being converted to water soluble already or water soluble state already. Naapag yun na siya yung mga retention of particles since they cannot accommodate all at once. Okay, again, it is more than what the body needs. Now, the major excretory structures in the body are the renal glomeruli, which hydrostatically filter small molecules through their pores. Same goes with your porosities. Now, the major excretory organs, such as your kidney and liver, can efficiently remove only highly hydrophilic substances. Sounds lang ganyan kaganiya. Usually ionized chemical such as organic acids and bases. The route and speed of excretion depend largely on the physicochemical properties of the toxicant. So if the absorption differs on the physicochemical properties of the toxicant, well, the excretion will also depend on that. Okay? Whatever comes in matters to what is going to come out. Okay? Now, because of that, there are specific reasons. And these are as follows. So as you can see, only compounds dissolved in plasma water can be filtered. Aside from that, transporters in hepatocytes and renal proximal tubular cells are specialized for secretion of only highly hydrophilic organic acids and bases. Only hydrophilic chemicals are freely soluble in aqueous, urine, and bile. Lipid-soluble compounds are readily reabsorbed by transcellular diffusion. So if the body ilaang ma-detect that there are still these lipid-soluble substances, of course, ila na reabsorb because it cannot be excreted. Okay? Okay, it was not converted to hydrophilic substances. Now, you know what? Aside from those excretion that we know, there are possible routes of excretion of the toxicants. It could be the mammary gland after the chemical is dissolved in milk lipids, which is loe kayo ang baby, no? Aside from that, we also have excretion in bile. It can be extracted by the liver and excreted into the bile. The bile drains into the small intestine and is eliminated in the form of feces. Aside from that, we also have volatile non-reactive toxicants such as gases and volatile liquids diffused from pulmonary capillaries into the alveoli and they are being exhaled. Now, come to think of it, if we only got to have inhale those things, then wala exhalation. Wala na, trap na ta. Because our lung itself is very dependent, no? or shall we say, kuan kaya siya, luoy kaya siya. Siya pinakaluoy, isa sa pinakaluoy nga organ sa atong body. Dali ra kayo, very sensitive. Aside from that, we also have your sweat and your saliva. Well, saliva is really quite more known, as well as your sweat, compared to the other threes. But yeah, they could also be if a form of route of excretion. So lastly, we have your metabolism. Well, again, under your metabolism, we have two phases that goes through it. Your biotransformation under phase 1 and phase 2. And each phases, they have their specific process. Okay? However, the process by which administered chemicals or the parent compounds are modified by the organism, usually via enzymes. Now, the primary objective of metabolism is to make chemical agents more water soluble and easier to excrete. Okay? So, redundant na lang siya. Decreasing lipid solubility means decreased amount that reaches target. Ano man? Why do you think? Decreasing lipid solubility means decreased amount that reaches the target or site of action. Why? Why do you think? Tingin ka ganina, the more... Okay, go ahead, Axel.
As what you said earlier, ma'am, lipid soluble xenobiotics diffuse easily to our membrane barriers. For example, our lipid membrane sa ato body, so they diffuse easily, and decreasing their solubility will eventually decrease the diffusion of these xenobiotics. As a result, they are decrease po ang amount or the effect that will be manifested by that drug or by that xenobiotic.
Exactly. So, come to think of it, if there are instances, let's for example, let's say it's not in a form of a drug, it is a form of a chemical, liquid, or volatile substance that enters a patient's body, and it could lead to toxicity. What could you possibly, or unsa inyong pwede mabuhat ana ang patient? Excluding in a form of intravenous, of course, it is easily being mixed if it is in a form of IV. However, if it is being taken oral or per oral, syempre wala lugay nakabalo ang tao nga gi-poison siya. Butangan niya dito og kanang arsenic nga solution. Could you still help the patient? Could you still help the patient? Or mamatay na siya diretso diha dayon? Let's say the patient didn't know that someone put a spike under the form of arsenic sa iyang drink. And then you, as a allied health profession, you have the possible basis, like the patient is suffering from a specific effect of what she or he has been taken without identifying the chemical. Wala pa ninyo wala mo nasayod kung saan ang chemical. But could be the patient is kanang namugnaw siya, kalit lang in a specific na moment, namugnaw siya, na kanang murara siya og in a form of convulsion na gyud ang iyang atake. Can you still save that patient? Do you think you can still help that patient in that state? Or pati mo mataranta mo? Well, let me tell you, if the case is per oral, and of course it still goes a lot of barriers that they can go through chemical substances. Well, if you don't know how to aid it on that specific moment, and you see that the person is quite suffering, you can still help the patient. You can call immediately the nearest emergency hospital or clinic or whatsoever that handles this kind of situation. Kaya again, dili siya diretso mo penetrate. Sama that was stated earlier, napa siya agian. So, but dili pod na to siya langay-langayon. We need to have that urgency if we are na-notice na nato that there is something on that patient or on that person. Quickly, if he or she is not that quite responsive, then immediately, okay? We should always put in our heart the urgency of what could possibly happen. So muna siya, we can still help the patient. That is why gali we are also learning toxicology so that if we can still help the aid through the antidotes that we know, pwede pa nato matabangan. Pero if we really cannot handle it, well, let's call immediately to the nearest help that we can have. To be sure that they can really help out. So, niabot man ta dira. Going back to the metabolism, yes, that is correct, Axel. Now, increasing ionization, it increased rate of excretion. Same goes lang yapon sa example ganina. It decreased then the toxicity because it is already being excreted. However, let me tell you, if a person is being poisoned, yes, we can help out the excretion of the substances. But let me tell you, dili na siya one time nga mawawala diretso. We can aid it, but naapag yun yung mga substances nga na ay ma-retain. Mo nang, we need to monitor those people. We need to monitor those patients in order to fully excrete the chemical substances that once entered their body. Kaya dili na siya one time, big time. It's still a process. Okay? In some situation, biotransformation results in the formation of reactive metabolites. It could cause bioactivation. Whether it is a parent compound or the metabolite, it is the active compound that does the damage. And we all know that under your metabolism, it could really activate it. Okay? Now, these are the key organs of your biotransformation. Under your liver, of course, it has a high level or rate of biotransformation. Also, under your lung, kidney, and intestine, it could have the medium level. But the other not stated here, they can just have the low state or low level of biotransformation. Now, biotransformation can affect the rate of clearance of compounds. Now, again, we have here your biotransformation pathways. If you can remember, the phase 1 enzymes, it makes a toxicant more soluble. Phase 2, it links with a soluble agent through conjugation. Now, just a recap. So this is how your toxicant goes upon entering your body. So I guess that would be all for today. So the quiz oh, by the way, do you have any question clarification? So I guess in your reaction, wala man. So silence means yes. So I think that would be all for today. For tomorrow, again, we will be, yes, Ray.
Regarding sa quiz tomorrow, ma'am, the coverage should be the last and this discussion or kanilang karon yung discussion?
Last and this, and yes.
Okay, ma'am. Thank you po.
Okay. And then again, ay mong kabala ka kay group quiz man. So, tomorrow na ako mag-ingon, princess, kung pila mo ka buka basin i-prepare ninyo yung mga groupings. Sarot. So, I have already prepared the list of people per group. So, yeah, I'll just see you tomorrow. And then after the quiz, we will have, if we still have time, we will still continue, especially with I think the next lesson that we will have is with regards to antidotal measures and specific antidotes. Okay? So, yeah, I think that would be all. If you don't have any questions, clarifications, I'll see you tomorrow at 10:30. Okay? The door will close at 10:31. Okay? No further questions with regards to tomorrow's quiz? Okay. Thank you, everyone. Have a great and restful night. See you tomorrow. Bye.
Thank you, ma'am. Good night po.
Bye, ma'am. Thank you.
Mm-mm.
Thank you.